what we're looking at, this is a young patient, and she had orthodontic treatment, and then after the treatment, you can see from this photograph that she had what is termed peg-laterals. That means congenitally her lateral incisors.
Like baby teeth?
They are not baby teeth. These are permanent teeth that came in after the baby teeth, but they are called peg-laterals because nature shaped them like this. This is not an uncommon process for a patient. So it was known before the orthodontic treatment was started that some cosmetic treatment was going to be done. Wasn't sure how much was going to be done because we didn't know the end result of the orthodontic treatment. So I want you to look at this before and this after.
Yeah.
And there's only a month in between. Beautiful. Now, this transformed this young lady into a young woman. I mean, this is stunning. This is fun to do.
Yeah, what a difference, huge difference that teeth can make. You know, we talked off camera, and I said, well, you know, it sounds like you're making a big deal out of this teeth thing. You're obviously biased as a dentist, but this is one of those that you would call an extreme makeover. And all you did was change your teeth.
I only did this was actually a fairly easy treatment or case to do, and there's not that many veneers.
She looks smarter in the after.
She does. People are, you know what?
Like a class difference.
Well, I don't want to say.
I mean, unfortunately, I mean, we judge people by the way they look sometimes.
Unfortunately, and it may be unfortunate, but that is the nature of our society. That's why there's magazines, because every month they want to see new faces and new smiles. I mean, this is human nature. But think of the results of this, the confidence and the happiness.
This is a young person.
She's, I don't know how old she is now, but 22, 23.
Yeah.
I mean, this is stunning.
Okay.
This could be in People magazine. You don't know who these.
She could be. The one on your lap, is that her too?
No. Now I want to show you. Here we have a very pretty lady, and she's a grandmother, and you can see her upper teeth are a little yellow and worn down. You don't see a lot of the teeth in the lip line, in the smile.
So that you consider an older smile?
Well, yes. I mean, that's the reality of it. I just showed you mine, and it was similar before. So, but the difference here is that this pretty lady, grandmother, had a granddaughter on her lap, and I hear this story all the time. And you ask why people come in.
Okay.
Well, because her granddaughter says, "Grandma, why are your teeth so yellow?"
Yeah.
So I mean, that'll bring tears to the eyes of the grandmother.
Is that right? Okay.
This is an emotional issue. This isn't about teeth. This is about feeling good and having everyone around you feel good.
Okay.
And you can see the end result. Is this incredible?
It's a young smile.
It's a young woman.
She looks younger.
Absolutely. Much younger. And she's happier.
Okay.
And the end product of this, the benefits keep coming back and back. The patients don't even realize the true benefits until months later or years later.
We have time for a few more.
Great. Well, now we're getting into the extreme makeover. I mean, the real extreme makeover. Okay. And so I'd like to show you, because I'm talking about life-changing. It's going to be evident to the folks at home. And I just want to go through this photo right here, and people will recognize, well, yeah, that's a person that needs help with their smile.
Yeah.
But I also want to say this is a very successful, very intelligent woman. She's an attorney.
Mm-hmm.
And she's had that smile for many years. Let me say something right here. People that have teeth that need treatment, that they don't feel good about, their facial appearance changes. They don't smile. They put their hand over...
Was she covering her mouth?
Covering her mouth. They put their hand over their mouth. They don't smile. People think that they're actually either conceited or just not very friendly, when in fact they're inhibited and fearful.
Because of their smile.
Absolutely. This isn't about teeth. It's about their emotional health. It's about their physical health, about their emotional appearance, their physical appearance.
Okay.
So let me show you after...
So what'd you do for her, by the way? Because she had a lot of crooked teeth.
Well, this is, like I said, very extreme makeover. And we spent 8 hours one day doing her treatment. To her, it was nothing because she was sedated the whole time. So Randy, just look at the before and after of this. Now,
wow.
I mean, this is not just a physical change. This is emotional change.
What does she say to you? Because that is a big difference.
Well, we spent actually hours in depth talking about the issues around her teeth. And she is so pleased, so happy. She actually emailed me every week for the first year after this treatment was done. Now she emails me periodically. I see her for regular cleanings. But let me tell you a story that she had right after this was done. Now, and thinking back to how the before looks, this story. So she calls me up and she says, okay. I'm in San Jose, you know, so she was traveling in Los Angeles. So some man made the effort to come across the concourse where she was walking and came up to her and says, "You have a beautiful smile."
Is that right?
Now, if that doesn't send chills up your spine, nothing will. Because you think that ever happened before?
No. Well, she does have a beautiful smile.
She's a beautiful woman.
Very attractive woman.
Very.
But this picked it up a notch.
It's more than that. Yeah. It's a change of life for the better that people can never understand until they see the need and then have the treatment completed.
I think what you remember oftentimes about people is their attitude and their smile. You know,
yes.
Friendly person.
Yes. Yes. Well, we're very cosmetic oriented in cosmetic surgery and all those types of procedures, facelifts, eyebrows.
Do you ever see that, knowing I'm going to interview a dentist again?
Yes.
I see a lot of people, especially women, that take care of their nails and their hair
yes.
and their face, and they've got these old teeth. Do you ever look and say, boy, I could change that?
Well, of course I do, with every person I know. I don't want people to be self-conscious when I walk in the room, but that's on a social setting. If they're in my office, I'll tell them just how it is. But yes, people they can't imagine the change in their life and how easy it is. It's actually with easy. Sedation dentistry and 2 appointments and to change your life forever.
Okay. They last. They last.
They last. Again, the longevity of the treatment is incredible because of the new strength of the ceramics that we use and the beauty and the naturalness of the ceramics we use. But the other factor is, again, I got to go back to the way the bite fits together. The occlusion, because after the treatment, the bite has to be equilibrated. Occlusal equilibration, one of the key words. Google it in, folks, because if the dentist isn't talking it, then you're not going to get it. And that is the success of the treatment. Whether it's
go to a dentist,
whether it's cosmetic treatment or whether it's just general dental treatment. If you don't have a bite analysis done, you're not going to have the treatment you need.